So let me start now. I wanted to just to say thank you to Brenda. When we met in the spring, we talked about this idea. I love the idea of what's possible with getting leaders from different parts of healthcare together to reimagine what healthcare could be done. We're shaking things up here already, you can tell. So I shared my story, and Brenda asked me, why did I leave Dalhousie? I used to work with Brenda at Dalhousie, and I told her the story, and she said, could you share that with the audience today? So I'm not sure why I agreed to that. Normally, as Liz and Sherry talked about, we put the donors first and the doctors and nurses first, and we in philanthropy are in the background. But today I'll do it. So I wanted to share my story and talk a bit about why I joined Dartmouth General. So let's talk about Helen. Helen, my mother-in-law, incredible woman, great-grandmother, incredible family member. I'm here because of Helen. At Dalhousie, I worked with Brenda and the other deans of each faculty to really advance the mission of Dalhousie, to really translate academic excellence into Halifax, Nova Scotia, Canada, and around the world. I loved it. Loved working with Brenda and the team. And I see Victoria and Catherine here. We made a difference. It was a truly incredible time at Dalhousie. In early 2015, though, my mother-in-law, Helen, was admitted to the Dartmouth General. She had become seriously ill from complications from Parkinson's disease and from cancer. The prognosis did not look good. Suddenly, all of our attention shifted to supporting Helen and the family. I was thinking about care. I was thinking about comfort for her and for my wife, Jennifer, who's here with us today, who was watching her mom go through something that no family is ever ready for. We were scared. We had questions, and then something remarkable happened. The phone rang. At home one night, we received a call from Todd at the Dartmouth General. We didn't know that Todd at the time was the medical director and co-site lead of the Dartmouth General, the top doctor at the hospital. He took time to call my wife, not just to explain the situation, but also to connect. Human to human. He listened to her. He set a care plan in motion that made sure that Helen was comfortable and was not in any pain. He said, my name is Todd. Call me anytime. We're here for you. If you have a question, if you want to call, here's my cell phone number. I turned to Jennifer and said, wow, who does that? That's incredible. Now, I've worked in many large institutions across the country. I've seen senior leaders protect their time religiously and carefully. But here was someone at the top of the organization giving out his personal phone number to a worried daughter, offering not just expertise, but presence, being there for her. And I remember thinking, that's different. That's something that stayed with me for the last 10 years. It wasn't just care, it was culture. The culture of the Dartmouth General, we felt it was different. The care Helen received was very human, but I did see gaps. There were gaps for sure. The MRI, Helen needed to have an MRI, but Dartmouth General didn't have an MRI. So she said she wasn't able to withstand the transport across the harbor or up to Antigonish, so she refused care. She refused, given her seizures, it wasn't possible. So after that, we made the very difficult decision to move to palliative care. With no hospice beds available in HRM at the time, Helen stayed with the compassionate team at Dartmouth General and passed away in the hospital April 2015, 10 years ago this year. Fast forward to 2018, the search for the president and CEO role of the Dartmouth General Hospital Foundation came up, and it caught my eye. I remembered my time at Dartmouth General. I love the university, still do, still love what Dalhousie's doing, but Helen's experience came rushing to the front. I kept thinking, what if I could help bring them an MRI that was state-of-the-art, that could change diagnosis, that could change things for other patients? What if I could help ensure that there's enough palliative care beds so that no family would have to go through what we went through, so that their loved ones could die with dignity and grace? So I made the leap. I joined the Dartmouth General Hospital Foundation not because I had to, but because I couldn't not. As I stepped into this world, I saw something deeper. I discovered doctors who went by their first name. That's different. I got to know Carla. Carla, or Dr. Pittman, we call her Carla. She's here tonight as well, Carla. Carla sent me a beautiful welcome package to my home with coffees and mugs. How'd you know I like coffee? I don't know. But again, I said, wow, that is different. That is incredible. And Carla was a champion for physician giving at the Dartmouth General Hospital. She chaired the Above and Beyond campaign, internal campaign, and also our external campaign. And that's where the culture really shone through. Carla, along with all 85 doctors, 100% of the doctors gave to our campaign. That's normally 30% in Canada. 100%. Yes, round of applause. 100% of the doctors gave, and that speaks to culture. I felt it. I felt that culture. We were different. Not only was this a place of compassion, though, this was a place of innovation. We have Rachel and Natalie here tonight as well. I saw teams working to improve patient flow in real time so no one falls through the cracks. I met clinicians who weren't satisfied with good enough. They were looking for, how can we reinvent care, patient care? There were pilots for vital signs monitoring, a first in Canada, a drive-through blood collection site from the UK, a new palliative care unit, a pilot for AI-assisted colonoscopies, the first in Canada that AI was used for colonoscopies, ideas for transforming women's health with the Deanne Reed Pelvic Health Suite. Yeah. So many Atlantic Canadian firsts and Canadian firsts. We had talk about Jennifer working on the orthopedic robot. She had a dream to bring the orthopedic robot from Stryker, the Mako robot, to Dartmouth General. Because of that, she was able to do the first robot-assisted hip replacement in Canada at Dartmouth General. These doctors were always saying, how can we do things better? How can we do things better for the patient? What's next? What does the patient need next? Now, when I was at business school at Dalhousie, I learned from them that Peter Drucker would say that culture eats strategy for breakfast. What does that mean? Henry Mintzberg from McGill, he would say that an enterprise is a collection of human beings, not a collection of human resources. Never were those two statements truer than here at the Dartmouth General. I see the culture, I see what's possible, and I know that the power of philanthropy is really about people. People give to people. As Liz and Sherry, we went through that with you guys too. That's what embodies human beings given to each other. Healthcare is about people. People creating more than a human experience for families like mine. And for me, it isn't just work, it's personal. Because one day, we were just a family walking into the hospital, scared and unsure. And someone at the very top called us and said, we're here, we care. Call me anytime. That kind of leadership, that kind of culture, that's worth fighting for. That's worth fundraising for. That's why I'm here at the Dartmouth General. Thank you.